Good afternoon. I think we'll start. I'm Sam Rushforth, the Dean of the College of Science and Health, and it's my pleasure to introduce to you one of my dearest friends, Dr. Arden Pope. Dr. Pope is one of the premier air quality scientists in the world. I don't know why in the world he stays at BYU, but everybody's been after him for years. But
UVU's never invited me.
Oh, hey, I'm getting there. For the first 5 years I was here, I used to say BYU when I meant UVU. No, but he's been at BYU for a very long time, and he works with air quality scientists from all over the world, collaborates with a whole bunch of people, and does magnificent research work, and has done work now recently where we're learning more and more about the ways in which air quality, bad air quality, causes harm to the body. It's not just jamming up your lungs at all. There are a whole series of issues involved with health and air quality. And our valley here, as you well know, has terrible air quality. And I'm just going to give the briefest of introductions to Arden. He has a PhD in economics and worked for his first years doing agricultural economics in the Midwest. Came here, 3 young women a few years ago started an organization in our valley. They got letters of people complaining about the air quality in Utah County, and when they went up to the Division of Air Quality, they said, nobody in Utah County complains about the air. But they came back down, put together a brochure, put it on some telephone poles, got the Orem library, and said we're going to have a meeting Tuesday night, figuring they'd have 20 people show up. It was overflow, 250 people, and Arden was there, and the people from the steel plant were lying through their teeth about their pollution figures and what they were doing to the air. And Arden simply said, well, I'm an economist, but I'm a biostatistician, and I can follow this. So he started, we had a natural experiment in the valley that started air quality work, didn't start, but bumped air quality work up across the world. The local steel mill was open and then closed for 13 months and then open again. And Arden was carefully tracked the number of adults, but especially children, that were admitted to the hospital during those 2 periods of time, open, 3 periods, open, shut, and open. And it was fantastic work. Nobody could refute it. The steel mill people brought in some MD hacks, essentially trying to shut down the work or to disprove it, and they couldn't disprove anything. And Arden's work has held up through the years and will continue to do so. And we are exceedingly fortunate to have him in this valley, and we're exceedingly fortunate to have him here today with us speaking. So thank you very much, Arden.
Thank you, Sam. It is true that I consider Sam a very good friend and in some ways a mentor. He was fearless in those days. Obnoxious, but fearless. Hasn't changed? Oh, I hope not. It's pretty amazing. Amazing man. Thank you, Sam, for the introduction. So, You know, I'm just going to try to combine some health stuff, some policy stuff, some controversy stuff in one presentation. Is that okay?
Of course.
And I think this might be fun. Will be for me, maybe not you. So here's an illustration in Charles Dickens that sort of illustrates the iconic role that smoke and fog and smog played in London historically. You can see a chimney sweep and a smokestack. I don't know, is there a way to see that a little better, maybe with those lights?
Turn those lights on.
You know?
Where's,
Yeah, that's much better, thank you. So, I mean, here's a Gustave Doré illustration that actually occurred in London. This is in April 6, 1870. Doré's friend says that they were it was in the morning, it was as dark as midnight. It was choking, it made the eyes ache. I mean, air pollution's been around a long time, certainly London. Monet used to love to paint photos or paint pictures of paintings of various places in London. Here's, of course, the Houses of Parliament. Another view of it illustrates the pollution. Here's a painting of Waterloo Bridge, again, Monet. And you can see the bridge, but then look at the background. The pollution was pretty bad. A lot of sources of pollution, but primarily burning of coal, the industry, a lot of coal in the industry as well. And then they had increasing amounts of diesel automobiles. It also happens that Adam Smith, a Scottish moral philosopher, sometimes referred to as the father of economics, during the time in London, even though he was a Scot, even in London, he was very familiar with London, very familiar with the circumstances there. He wrote this book called, ironically, actually, Wealth of Nations, how free markets, competition, and of course he introduces to this metaphor of the invisible hand, and basically established what we often refer to as the doctrine of laissez-faire. And how did this relate to the air pollution that was so common? Well, the idea basically is air pollution, it smells like money to me. Right? But then in December 1930, in an industrial valley in Belgium called Meuse Valley, there was this real bad temperature inversion. And this temperature inversion basically trapped the pollutants from the industry in the valley on the valley floor. And over a period of just a few days, they had about 60 deaths, 10 times the normal. And it was stunning. It was a clearly well-documented episode of air pollution where people were dying associated with the episode. A few years later, a little closer to home, this is in Donora, Pennsylvania, not far from Pittsburgh. You've got the Monongahela River there's this sort of bend in the river, and you got this community of Donora. And it sort of sits between some hills on one side and bluffs on the other. You have this industrial pollution. Then you even had coal-fired barges going up and down there. And it was a very polluted city, or town, really, just a community. Pretty polluted. And during bad inversions, the pollution would get really bad. In fact, the worst episode occurred in October 1948. This is a photo of downtown Donora at noon. Pretty stunning. I've spent some time in Donora. It's an interesting place. It actually, in many ways, it hasn't changed that much, but most of the pollution sources have left. They don't exist anymore. Very well documented episode. About half the community were ill. They ran out of coffins. Half of their doctors got sick. It was a pretty bad episode. The concern, of course, is in Donora, man, if something like this would happen in a big city, would have thousands of people die. And then, of course, almost as if on cue, about 4 years later in London, a big city, December 1952, they had this episode. This is the daytime that we're looking at. This is in the middle of the day. They had this bad episode. Here's a kind of a classic air pollution illustration where you see you had this period of several days where British smoke, a measure of fine particles, sulfur dioxide, basically this period of very, very high elevations of air pollution was accompanied by dramatic increases in deaths. And these deaths remained high for about 2 weeks. We still debate even today exactly how many people died due to this episode of air pollution, but the estimates of about 8,000 to 12,000 are pretty close to the truth. So, these episodes really helped us lose our faith, if you will, in the doctrine of laissez-faire, at least when it comes to serious episodes. Or air pollution episodes. No longer did air pollution smell like money. It smelled like something very unhealthy. In the UK and the US and elsewhere, there were public policy efforts to clean up the air and eliminate the killer smog episodes. There are the original sort of Clean Air Act and then the amendments of 1970, more recently the amendments of 1990 in the United States. Very significant, of course, even the establishment of the EPA in the early 1970s. So there was very clear evidence that we just can't let things alone, follow the doctrine of laissez-faire. We really need to do something if we want to protect human health. And there was substantial success as a result of this, eliminating or reducing these extreme air pollution episodes. But it turns out that air pollution remained. And so we had much more moderate air pollution, certainly in the U.S. And it turns out that there are still health effects even at these levels. So this brings us to Utah Valley. You'd think this wouldn't be a particularly great valley to study. Oh boy, that's beautiful there. Isn't that beautiful? Beautiful campus. Now we cheat a little bit. We find the prettiest days, although today it's just this pretty, isn't it, out there? Gorgeous. Gorgeous valley. You wouldn't think this would be a great place to study air pollution. This was the steel mill. This is an actual photo in 1989. This is a period. This is when Geneva Steel was operating. There's no real fog here. What you're looking at here, a little bit of steam, but what you're looking at here is fine particle air pollution. We didn't have measures of PM 2.5 at that time, but we did have measures of PM 10 on this particular day at the Linden monitor. It was 150 micrograms per cubic meter, which is very high, because these are stagnant air conditions. About 80% of this PM10 was actually PM 2.5. So we're talking PM 2.5 levels right here at about 120, 130 micrograms per cubic meter. And incidentally, last winter, even without the steel mill, we had a couple of episodes, one episode in particular where it was 120 PM 2.5. The valley was really bad back in those days. These were the heady days of air pollution. Back in those days, when a real bad day, you couldn't even take a photo in the valley. You had to get up above the inversion. Steel mill sits here. You have these sort of thermal bubbles above the smokestacks of the steel mill. And then, of course, the question is does this stuff actually cause health effects? Sam's already mentioned the idea that we have this sort of natural exposure chamber here in Utah Valley with mountains on both sides. This valley, at the time, we had a big source of air pollution. And of course, we continue to have then and continue to have air pollution from automobiles and other sources. There was this local steel mill that contributed about 50 to 60% of PM 2.5. It shut down for that 13 months that Sam mentioned. And so what we have is a natural experiment. This is pretty cool, isn't it? We shut down the air pollution in our exposure chamber for 13 months, and then we turn it back on. What did we find when we look at the hospitalization data that Sam mentioned? Well, basically what we find is that when the steel mill was operating, air pollution was a lot higher than what it wasn't operating. But what was striking, and by the way, I hardly could believe these results, and it'd be fun to tell some of the stories about, me just being scared somehow I'm missing something, but it was so obvious. Here's pediatric admissions, hospital admissions for bronchitis and asthma. Steel mill open, closed, open. Pneumonia and pleurisy open, closed, open. Total pediatric respiratory admissions, open, closed, open. Now, we've done all sorts of fancy statistical analysis on this and have published even other papers related to it, but you can see pretty much the results. When the steel mill was operating, the pollution was worse and pediatric respiratory disease was worse. Now, incidentally, there's another way to do a natural experiment in Utah Valley that works quite well, and that is it doesn't even require the shutting down and reopening of Geneva Steel. Basically, you have the exposure chamber and you can put a lid on it, right? Put a lid on the valley, which is what we call temperature inversions. You'll get a buildup of the concentrations of air pollution, and then when a cold front comes through or when it gets warm enough that the inversion lifts, you'll have it get very, very clean. So what I have shown here is really just the temporal variability associated not with the steel mill, but with just natural variability in Utah Valley due to changes in weather conditions. And then you can take this information and link it with what I have here is daily mortality counts. So these are daily mortality counts in the valley. You can then sort these daily mortality counts by levels of air pollution, which I've done up here. There's nothing fancy going on. This isn't really statistical modeling. All I'm doing is sorting the mortality counts and plotting it over quartiles of pollution. And what do you see? Wow, it's pretty amazing, isn't it? Now, we can do more sophisticated analysis. So we could do Poisson regression. I won't go into the details of the Poisson regression approach and the various controversies associated with doing it. But over the years, we've figured out how to do this quite well. And when you do this analysis, where you basically regress the non-stationary Poisson process with respect to air pollution, time trends, temperature, relative humidity, and other things, what you end up with is estimates not only from Utah Valley, but now from hundreds of cities throughout the world. We get estimates that a 10 microgram per cubic meter increase in PM 2.5 is associated with about a 1. In fact, I just reviewed, there's a brand new meta-analysis of the daily time series studies of PM 2.5, and the meta-analysis gets you almost exactly 1% increase per 10 micrograms per cubic meter increase in 2.5. Yes?
What's PM 2.5 and PM 10?
Good question. I should have told you that. PM 10 is particulate matter that's 10 micrograms or smaller in aerodynamic diameter. So these are particles that are way, way smaller than the width of a human hair. PM 2.5 is particulate matter that's 2.5 micrometers or less in diameter. Very, very tiny particles. PM 2.5, we don't have mechanical processes that make those tiny particles. About the only way you can get particles less than 2.5 is through high temperature combustion type processes. So burning coal, burning wood, steel mills, coking operations, or reduction operations like copper smelters, burning diesel, burning gas, that kind of thing. Does that help? So sometimes PM 2.5 particles are sometimes referred to as soot particles, but they're more than just soot. They include nitrates, sulfates, and a number of other types of tiny combustion-related particles. Thank you, good question. So this is the pollutant, this PM 2.5 pollution that seems to be causing most of the health effects that we're observing, these tiny particles that we breathe. Basically, you can think of them almost as smoke, if you will, okay? Although it's a bit more complicated than that. Well, we did a whole bunch of these sorts of studies, time series studies. Sam and I were very involved with a lot of this research at the time, and Sam already mentioned that there was some controversy. I got in I won't go into this too much, but I mean just to sort of document this, the New York Times, for example, ran an article, Utah Mill lies at heart of fight for air pollution. And it documents that Geneva Steel studies as well as other studies. Wall Street Journal, Provo, Utah provides combatant clean air fight, that kind of stuff. In some ways, it seems silly looking back on it. It didn't seem silly at the time. Yeah, it was a tough time. The bottom line, however, is that we learned that short-term changes in exposure to air pollution contributed to death counts, like I've already demonstrated, increased risk of death, increased risk of hospitalization. We saw declines in lung function. We see increases in respiratory symptoms, school absences, ischemic heart disease. It'd be a lot of fun if we had about 3 days to go through a lot of these different study designs and show how we've learned some of this stuff. But it became pretty obvious that day-to-day, i.e. short-term changes in air pollution, were associated with adverse health outcomes. So then the question is what about longer-term air pollution? And it turns out that longer-term air pollution, as you might expect, is even more important in terms of impacts on health. We knew this, or at least we had some evidence of this, as early as 1970. A guy named Lester Labe and one of his students, Eugene Seskin, wrote an article in the journal Science in 1970, and then later a much more expanded analysis of this work in a book called Air Pollution in 1977. The gist of their work is that even trying to do all the sophisticated analysis you could do, ultimately what you saw is that part of the variation in mortality rates across the United States, not all of it obviously, but part of the variation was due to differences in exposure, long-term exposure to fine particulate air pollution. And you can see this. This is actually not from their book. This is a more recent analysis that I did, but still it's the same thing. These are adjusted mortality rates across metro areas in the U.S. These are median PM 2.5 concentrations. And you can see there's a lot of variability, not explained by air pollution, but some of the variability in mortality is explained by air pollution. These studies, I wasn't around when these studies were originally conducted, but they had a lot of controversy too, and in the end were largely ignored. Okay? The concern was, they're just ecologic studies and you're not controlling for individual differences in age, sex, race, cigarette smoking, body mass index, etc. So we need to do that. Well, it turns out that Frank Spicer, a guy named Benjamin Ferris, Doug Dockery, and a few others started a project or a research project called the Harvard Six Cities Study. And basically what they did is they did about a 14 to 16, at least originally, a 14 to 16 year prospective follow-up of over 8,000 adults living in 6 U.S. cities. They monitored TSP, which is total suspended particles, any particles suspended in the air, PM10, particles that are less than 10 micrometers, PM 2.5, SO4, that refers to sulfate particles, hydrogen ion or aerosol acidity basically, and then various gases, SO2, NO2, O3. And then I actually happened to be at Harvard at the time when this data had been followed up, and was the one that actually did the analyses or did the primary analyses on this original study using survival analysis, including what we call Cox proportional hazard regression modeling. But the important point here is that we could control for individual differences in age, sex, smoking, body mass index, education, occupational exposure, and other factors. What did we find? Well, this is one way to sort of illustrate the results. So we have 6 different cities, 2 highly polluted cities, 2 clean cities, 2 sort of average polluted cities. And then what you do is you enroll them at time naught. So on the horizontal axis, we have the years of follow-up. At time naught, we enroll everybody in all of the cities, and then we follow them up, and we look at these survival curves and see if they differ. And what you see here is at time naught, 100% of the people are alive. That's a condition of enrollment. And then we follow them over time. And what you see is the people living in the more polluted cities are dying more rapidly than in the clean cities. And those sort of in the middle are sort of in the middle. Now this, you can do more sophisticated analyses using this Cox proportional hazard regression model, which you don't want me to talk about much. But the bottom line is you can do this proportional hazard model and estimate the relative risk, say, of a cigarette smoker that smoked 25 pack years of cigarettes at time of enrollment versus a never smoker. And you can look at their risk of dying conditional upon living to, say, a given day. What's their risk of dying in the next time period? And you see it roughly doubles for cigarette smoking. 8 times higher dying of lung cancer, 2.3 times higher dying of cardiopulmonary, meaning cardiovascular and respiratory. What does this say about cigarette smoking? Yeah, it's very, very unhealthy. Don't do it. But here's the interesting thing. If you look at, across the range of pollution that existed in those 6 cities, you see a 26% increased risk of dying of all cause, 37% increased risk of dying of lung cancer, 37% increased risk of dying of cardiopulmonary disease from doing what? Just breathing. That's a concern, isn't it? Now, when we got these results, it was very hard for us to believe them. All right, these are pretty big effects, frankly, for just breathing air. And so we wanted to do a similar analysis using independently collected data from some other cohort. And it turns, this is still Harvard 6 City, this is just a plot of the risk ratios across the levels of air pollution for the 6 cities, Portage, Topeka, Watertown, St. Louis, Kingston, Harriman, and Steubenville. And what you see is the exposure-response relationship is not just monotonic, it's near linear. Pretty amazing. So we wanted to see if we could see similar results in another data set, and it turns out that the American Cancer Society study had already had a fairly lengthy follow-up of a great big cohort called the American Cancer Society Cancer Prevention 2 cohort. So in that cohort, they'd been following up these people in up to 51 U.S. metropolitan areas. And so we actually went to the American Cancer Society, Michael Toon, Clark Heath, and others that work there, and asked them if they'd be willing to collaborate with us, let us link air pollution data to their cohort and analyze it in a very similar way as we analyzed the Harvard 6 City study. And so we did that. And by the way, now we're not talking about 8,000 some odd people. We're talking about the total cohort was over 1 million people, and we could actually link data with over 500,000 people. This is a big cohort now. And so we do that. I'm just showing you a slide similar to what I showed you before. Look at smoking. Is it still good for you? No, you get basically the same results with smoking. What about air pollution? Well, we get quantitatively somewhat smaller effects than we saw from the Harvard 6 City study. But still, we still see these very significant and quite substantial effects of air pollution. So we published both of these papers roughly at that time, sent them to a couple of journals, New England Journal of Medicine, maybe some of you have heard of it, American Review of Respiratory and Critical Care Medicine. These are top journals in the world, published those results. You'd think that that would have sort of helped us understand and develop better public policy, and it did. But there was a lot of controversy again. In fact, it almost made the Utah Valley controversy seem small by comparison. It was very national and became international. Here's just one article in the journal Science. Showdown over clean air science. Industry and environmental researchers are squaring off over studies linking air pollution and illness in what some are calling the biggest environmental fight of the decade. So we were, I don't know, you publish the papers and you hope that they do okay. It turns out that there was some concern that these ought to be independently analyzed, and so there was actually a large group of about 30 individuals that did this large 3-year reanalysis project. They audited the data. They validated and replicated the original results, and then they did a whole bunch of sensitivity analysis on both the Harvard and 6 City study. And by July 2000, they published this report that basically just validated the results that were originally published. And there were lawsuits associated with the standards that were being established for PM 2.5 based on these and the time series studies that I've already mentioned. This ended up going to the Supreme Court. So this is the Whitman, Administrator of the Environmental Protection Agency et al. Versus the American Trucking Association and a whole bunch of others et al. And the bottom line is in 2001, the court ruled unanimously basically in favor of the EPA in terms of establishing these standards. After that, what did we do? We just kept working, right? Francine Layden and Joel Schwartz took the Harvard Six Cities data. After all this controversy and stuff, there had been 8 more years of follow-up. And what was nice about the 8 more years of follow-up is some of the most polluted cities really cleaned up quite a bit. And in fact, all of the cities in the Six Cities study cleaned up. And what we found, or what they did, is they could look at the period of time when they cleaned up. And you can see Steubenville went from 30 micrograms per cubic meter of pollution down to, around 15. A big drop in pollution and a big drop in their mortality risk. Kingston-Harriman, similar thing, not as big, but still, reduction in air pollution, reduction in mortality risk. Even the cleanest cities in the Harvard Six Cities study had reductions in air pollution over this time frame and reductions in mortality risk. Now this, of course, is controlling for age, sex, race, cigarette smoking, and a whole bunch of other factors. In addition to that, while this controversy was going on and all that reanalysis, there's more follow-up of the the American Cancer Society study. After the reanalysis was done, I actually contacted the 2 lead researchers on that and said, hey, you guys did a good job. Let's work together and do some, add some more statistical analyses. I mean, this Rick Burnett and Dan Krusky are superb researchers. It was wonderful to get a chance to work with them. Michael Toon, Eugene Cowell at the American Cancer Society, George Thurston, Kaz Ito at NYU in terms of, contribute a lot in terms of exposure assessment. In working together with some of the best scientists that you can work with in this field, we published an extended analysis of the American Cancer Society study, published it in the Journal of the American Medical Association. This was in 2002. What did we find? Well, for cardiopulmonary disease, again, this is cardiovascular and pulmonary disease, and lung cancer mortality, increases in exposure were associated with increases in risk of dying. And then we did this other study with John Godleski and pretty much most of that other group I showed you. We actually wanted to look at, it was hard to believe that you had so much cardiovascular disease mortality associated with air pollution. So we did some additional analyses focused on ischemic heart disease, dysrhythmia, heart failure, cardiac arrest. And the bottom line is the evidence has become quite compelling that air pollution not only contributes to respiratory disease, but it contributes to cardiovascular disease. Now, it'd be a blast to talk about a lot of those things that Sam already mentioned. Many of these studies where we're focused on trying to understand how breathing air pollution can cause disease, especially respiratory and cardiovascular disease. I'm going to basically skip over all of those studies, although they've been a blast, and just sort of summarize it like this. What happens is you breathe particles into your lungs. You'll get inflammation of the lungs, you'll get oxidative stress in the lungs, you'll get an accelerated progression and exacerbation of chronic obstructive pulmonary disease, you get increased respiratory symptoms, these particles affect the pulmonary reflexes, and you get reduced lung function. This systemic inflammation and oxidative stress results in effects throughout the body, systemic effects, including increased C-reactive protein, a measure of systemic inflammation. You'll see increased pro-inflammatory mediators in the blood and elsewhere. You see leukocyte and platelet activation. You see, and I won't go into all of this now, but you'll see changes in the blood. You see changes in the heart, changes in autonomic function. You see increased dysrhythmias. You see, altered cardiac repolarization, etc. You see impacts on your blood vessels, increased atherosclerosis, accelerated progression, and destabilization of the plaques. You're getting the message, right? It turns out that breathing particles has a big impact on our cardiopulmonary health. Now, just a few months ago, we did an analysis. Now, when I say we, this is being generous. This includes a research team of about 450 people. Okay, so I'm just one of 450 people. This is called the Global Burden of Disease Study. And the journal The Lancet had one issue dedicated entirely to reporting the results of the global burden of disease. And what this does is it's trying to look at various factors that contribute to burden of disease throughout the world. You with me? And then what I've done here, this is sort of a summary figure of the kind of things that really impact burden of disease. High blood pressure, tobacco smoking, alcohol use, household air pollution from solid fuels. Well, what I want to point out here is 3 of the top 10 are basically breathing contaminants. Tobacco smoking, including secondhand tobacco smoke, is, if you look just at the US alone, this is the top risk factor. If you look at the world, it's the second top risk factor contributing to global burden of disease. Household air pollution from solid fuels, that's a big risk factor contributing global burden of disease throughout the world. Not a big one in the US. We have very little burning of solid fuels in the US. But many places throughout the world, in Pakistan, in China, in India, and elsewhere, they're burning dung, yak dung or other dung or other biofuels, wood, coal, in their homes, often poorly ventilated, and get enormous exposures to air pollution indoors. And then, of course, we have ambient particulate matter air pollution. Contributes substantial amounts to the burden of disease throughout the world. And if you look at it like this, in terms of the number of attributable deaths from breathing contaminants, if you will, tobacco smoking is clearly the biggest. Secondhand smoke, much smaller. Household air pollution from solid fuels, 3.5 million people die each year based on these estimates due to breathing air pollution in our homes from burning solid fuels. Ambient particulate air pollution, 3.2 million deaths. Now, most of those aren't coming from the US, although some are. Have you been paying attention to what's happening in China, for example, recently? Absolutely horrendous air pollution in many parts of the world. But these are big impacts on burden of disease. So then the question is well, the obvious question is has reducing air pollution, as we have done in the United States, has reducing air pollution resulted in a substantial and measurable improvements in health? And the answer is yes. We did a study a few years ago, published in New England Journal of Medicine, Doug Dockery, Majid Azadi, and I, where we basically matched PM 2.5 data across a 20-year period, looked at changes in exposure to air pollution with changes in life expectancy, and what we learned is that a 10 microgram per cubic meter decrease in PM 2.5 was associated with about a 7-month increase in life expectancy. With the possible exception of statins, the use of statins, this is the biggest life-improving intervention done in the United States in that time frame. Benefit cost analyses of how much it costs to sort of clean up versus the benefits. A number of these studies have been done. Here's a recent study. Blue is the benefits, orange is the cost. In terms of benefit-cost ratio, it looks like this is substantial. So, we seem to be making major progress in understanding the health effects of air pollution. In the US, reducing air pollution seems to result in substantial and measurable improvements in human health. This is good news, right? Well, it is. Not for everybody. August 2nd, 2013, so just a couple of months ago. Lamar Smith and Chris Stewart, our own Chris Stewart right here from Utah, subpoenaed EPA's secret science. Sounds like this is happening. You know, you see a pattern in this, by the way? Secret science, the Science, Space, and Technology Committee, an environmental subcommittee, issued a subpoena to the EPA forcing the agency to release the secret science it uses as the basis for costly air regulations. What two secret science? Well, basically the three studies that they were asking for data for was the Harvard 6-City study, the American Cancer Society study, and that life expectancy study that I showed you. Now, the life expectancy study, by the way, that data's been made public ever since we published it in 2009, because there's no confidential data in there. So that data is available for anybody to analyze if it wants to, and so on. The Harvard 6-City study and the ACS study, however, the raw data cannot be, it can be audited, it can be reanalyzed, but it can't be made public. And why? Because it's private medical data. I mean, we have IRB constraints on how to release that, and even that data also included a national death index data that we cannot legally release. This idea that this is secret science is pretty interesting. Will the science panel need an ethical review, etc.? So let me talk about this for just a minute. I've already talked about the Harvard 6 Cities and ACS study in terms of the results. But let's talk about it in terms of the secrets. Do you want me to show you the secrets?
Yes.
Who wants it? Yes, you do. All right, I'll show you the secrets. The Harvard 6 City study was published in the New England Journal of Medicine in that doesn't sound so secret, but maybe secret, in 1993. There was a replication of that using an independent data set with another research team, although some of the researchers were in common, myself included, of the American Cancer Society Cancer Prevention 2 cohort study published in the American Review of Respiratory and Critical Care Medicine in 1995. Due to the controversy associated with these studies, we released the raw data to an independent panel of 31 researchers. They spent 3 years with oversight from a 9-member expert panel and a peer review by a special panel of the HEI Health Review Committee. This included full data access that ensured the privacy and confidentiality of the research participants. The reanalysis included data audits, full replication and validation, and extensive sensitivity analysis. It was published in this special report, and also a series of papers were published in one special issue of a journal dedicated in 2003. Since then, there have been 3 extended analyses of the Harvard 6 City study published in top peer-reviewed journals. There have been now 8 extended analyses of the American Cancer Society study published in top journals, some of them I've shown, including JAMA, Circulation, Lancet. In addition to that, there have been a number of other cohort studies that have been conducted. The Women's Health Initiative study published in 2007, a study from the Netherlands, a study using the U.S. National Medicare data, a study using the Nurses' Health Study, Health Professional Study, etc. Okay? All published. Nothing I'm showing you here. It doesn't sound like I'm showing you much secret science, does it? All of this is published. Now, to put this in another perspective, I do want to make one quick thing. The cohort-based mortality studies, the Harvard 6 Cities and ACS study, I do not deny that they're important studies, as are these other studies. But if you put them in perspective with the scientific literature, what do you learn? Well, remember, there's the episode studies. There's the population-based cross-sectional mortality studies. There's the time series and case crossover studies, some of which I haven't even begun to talk about. There's the time series case crossover hospitalization studies, lung function respiratory symptom studies. By the way, there's many of them, hundreds of these, many of these, probably hundreds of these now. Intervention natural experiment studies, the cardiovascular and cerebral events studies, some of which I've done here in Utah, subclinical markers of, are you getting the message? Basically, the literature is so large and so complex and has been growing so fast. Doug and I published a review paper in 2006. We had to be somewhat selective of the studies that we used. How many references were in there? Almost 600. That literature has probably doubled since 2006. Okay? These are papers that are all published in the peer-reviewed literature. So what's next? I don't know. Thanks.
We have a few minutes for questions.
Yeah.
I'm just curious, we hear about rising rates of autism, Down syndrome, and other birth defects and disorders.
Yeah.
Did any of your studies, were you able to find any correlation, or did you look at that, different birth defects? And
There's a birth outcomes literature that I have not even discussed here. It's not, the literature I've shown you here is absolutely compelling. The respiratory and cardiovascular disease. That literature is absolutely compelling. If you look at the birth outcomes literature, it's not so compelling. There's evidence. It's certainly suggestive of effects, but I'm not going to make an argument that I know, like this. This is so compelling. I just think the scientific uncertainty is approaching, very low. But with the birth outcomes, it's tougher. Autism, there's a couple of studies that suggest autism effects, but it's just a few. You can't make this argument with autism or birth outcomes. Any other questions? Yeah.
So this last January was pretty bad, but probably not that unusual for winters around here. So what are the rates like from this last year?
Yeah, last year we had a couple of episodes that were around 100, 120. That's pretty high. In fact, that's about the worst we've seen since steel mill shut down. One of the things that's helping us out is that our winters have been way more mild, so we don't have as much snow cover. And to get real bad inversions, it takes the stationary high pressure system on top of snow cover. That's when we get our worst inversions. So you just watch this winter. If we have snow cover and we have a stationary high pressure system, you'll have a buildup of pollutants. Yeah.
So I know a lot of pollution sources have been removed, others have been reintroduced. I know it's mostly government regulation that they're looking for to help the community, but on an individual basis, what can we do? Things like carpooling, trying to use less of that type of transportation. What other things can we do to help?
Yeah, drive clean cars. There's a big difference between our clean cars and our heavily polluting cars. So large pickup trucks, large SUVs. Let's face it. There are some cars that emit almost nothing. So it's not like you have to quit driving a car, but drive a clean car. Okay, just decide when you go buy a car to buy a clean one. All right, and then of course carpooling, mass transit, not burning wood or coal for space heating, that sort of thing. That's all important. You have these runners here. The running. Don't run for your own safety. Don't run along roads. Think what you're breathing. Run someplace away from busy roads. During inversions, get up above the inversion. Go snowshoeing above the inversion, or go for a run in South Fork instead of down in the valley. That kind of thing.
Would a regular hospital mask help during the times of inversion as far as filtering anything out?
Not much, no, because it takes pretty good HEPA filters to actually filter out these particles, and so it doesn't help much. Yeah.
With all the studies, why is the regulatory system not putting in as many regulations to the corporations?
Since 1970, with the Clean Air Act and of course the establishment of the EPA, over the last 40 years, there's been substantial regulations. I don't want to, on the one hand, sound Pollyannish. But I don't, I want us to understand it. There have been massive efforts as a matter of public policy to clean up our air. So our cars are enormously cleaner than they were in 1970. The problem with cars isn't so much that they're cleaner. The problem is we just have so many more of them and we drive them so far.
What about within this last decade? It seems like they cut back on the regulatory system.
So the last decade, so in 1997, the EPA promulgated the new PM 2.5 standards, which helped. But remember, they were tied up in courts really until 2001. So in the last decade, we've now had PM 2.5 standards that have some teeth. And we've actually even made those standards more strict. The annual average went from 15 to 12 just recently. So there is some reason to be optimistic about the public policy going in the right direction. But I want to assure you, like what I just showed you here with regards to, I mean, think about this. Lamar Smith is the chair of the House Science and Technology Committee. And basically he wants to dismiss all of this research out of hand. Okay, and that worries you about what's going to happen in the future. We've been making progress. I just hope we continue to make progress. Wasn't a very good answer, I realize, as I listened to myself, but that's the best.
You're fine, thanks.
Yeah.
I saw international replica studies on there, but none from like China or India, those industrializing. Do you know anybody doing research over there in Chinese cities, India cities?
Yeah, and in fact, we just did a big, what's called a pop-up project. I was on the scientific advisory committee for that project, where it was basically the Health Effects Institute funding studies and training in research groups in India, in China, and elsewhere. So these places are clearly still underrepresented for these types of studies, but there's starting to be more, and you get roughly the same results as we see elsewhere. The biggest difference is the air pollution in China, for example, Beijing, we talked about our real bad episodes is about 100, 120 last winter.
Yeah.
China averages about that.
Yeah, that's
And during their bad episodes, they get up around 600, 700.
So can you speculate on whether or not there's going to be regulation, legislation? I mean, I don't know much about the Chinese political climate over there, but it seems like if they don't put a cap on some of that, a lot of Chinese.
There's a paper that came out just a couple of months ago, Michael Greenstone and some Chinese colleagues published in the Proceedings of the National Academy of Science, that uses a natural experiment in China to estimate the impacts on life expectancy. I actually, myself and Doug Dockery wrote an invited editorial on this paper. I know it quite well because of that. But they estimate that the loss of life expectancy is about 5 years due to the air pollution. Now, best estimates from active cigarette smoking are about 7 or 8 years. So I mean, this is.
But that's just breathing the air.
That's just going out with breathing the air.
Yeah.
Sorry, we're going to have to quit. Join me in thanking Arden for coming over.